have runner's knee and you're looking for a brace, which one should you choose? In this video, we're going to go over two options, a sleeve and a knee strap. We're going to show you how to determine which one might be a good place for you to start, because anytime you get a knee brace, it takes trial and error usually. And then we'll show you how to put each of them on, okay? Both of these devices provide pain relief, support, and compression to really any kind of pain that's on the front of the knee. That's called anterior knee pain. Runner's knee is one type of it, but because the knee has a lot of connected parts, braces can work for multiple different diagnoses. As long as it's on the front of the knee, either of these might be an option for you. Okay, so the first thing we're going to talk about is a strap. It's called a patellar tendon strap or a counterforce strap. This one is continuous, this one fits me, but some of them are adjustable with different kinds of straps. All right, so when you might want to use a tendon strap is if you have specific pain underneath the kneecap in the soft stuff. So in this bent position with a 90-degree angle, one finger called point tenderness, right when you push on the soft part underneath the kneecap, might be a good reason to use a strap, okay? So pain under there is number one. Number two would be if you have a positive patellar tendon press test. The patella is the bone. It's also interchangeable with the kneecap. So this test, patella tendon press test. What you're going to do is you're going to straighten your leg and keep it really, really relaxed. Shake your muscles a little bit so that leg is really relaxed. Okay, foot's relaxed. You're going to find that tender spot and push on it. And usually with everything relaxed, you can kind of really dig into that and it's real painful right at this one spot. Okay, so think about that pain if you get it. And then bend your knee and pull your toes up. Okay, that's going to tension everything. Almost take a little bit of pressure off. Push again in that exact same spot. If you don't feel pain when your knee is bent, but you do feel pain when your knee is straight and relaxed, that's a positive test, or positive patellar tendon press test. So, pain below the kneecap, usually point tender. And number two, a positive press test, where it's painful here, but not painful here, means you're going to want to wear a strap, okay? Or try a strap first. So how that works is you're going to, whatever strap you get, this one's continuous. Again, I said there's other ones that are adjustable. You're going to pull it up, and you're going to find the spot just where the tissues connect to the end of the bone, okay? And you want to aim high. You want to pull this strap up higher than where you think you need it, because it might slide down, okay? Most of these straps are going to have some rubber tubing or a little extra reinforced fabric, and you want that band to be right at the tip or the base of the kneecap. And then again, you'd stand up, do some calf raises, run or jump around on it to make sure it feels secure and it's not going to slide down. And you would wear this for activity. Okay? So that's the strap. Now the next one we're going to talk about is a knee sleeve. This is a neoprene knee sleeve. It has a hole cut out in it. I would suggest you start with that if you're not sure what you need. Something that's a continuous, simple, no extra supports, and just has a hole in the middle. All right? The reasons you might want a sleeve are that you have pain above the knee in the soft tissues, or pain right behind the kneecap. It's not as easy to localize as the other condition we talked about. Okay? And then we're also going to do another test for that for you to determine. So if you have pain above the kneecap or underneath it, and this next test, you might want to use a sleeve. So the test we're going to use is the active patellar grind test. And this is kind of a do-it-yourself, just kind of feel how it goes. What you're going to do is you're going to lay back and bring your thigh up towards your chest. You're going to leave your thigh there the whole time, okay? Now take your hand and cup it over the kneecap on the painful side and press in, okay? Holding this position, hand cupped pressure of the kneecap in its groove, and with your thigh staying in the same spot, you're going to slowly straighten your knee. So you're using your hamstring tension right here to create that pressure. And I had runner's knee, and I actually had surgery for runner's knee, and this was the only test that I could find that would, that I'd really get pain at that particular spot other than running. Okay? So if you're not sure, because this isn't comfortable for anybody, pushing the kneecap in, and getting pain in there. If you're not sure, do it on the other side. It may be discomfort, but usually one side is more painful than the other, and that's the knee that you're having problems on. So compress the kneecap in, straighten the leg, and if you feel pain under the kneecap, that's a positive grind test. Okay? So summary there. You may want to wear a sleeve if pain's above the kneecap or underneath it, and a positive grind test, the one laying down where you kick your leg up. Now for the sleeve, goal is to get your kneecap within the hole. You're going to bunch it up in your hands and pull it again, aim high, higher than you think you need it. It's going to take some work to get it on, especially if it's new or your skin is wet. Pull it higher than you think you need it to really get your whole kneecap in there. And then you're going to straighten it out. Okay? If your sleeve doesn't have a hole in the middle, what you can do is you can take scissors and cut. So you could cut a letter T or a cross. You snip just like that an inch, and you snip just like that, and it'll open it up. And you can create a hole in a brace that doesn't have one. All right, so summary. Both of these, a strap and a sleeve, can be used for anterior knee pain or runner's knee. The biggest takeaway is that it's gonna take some trial and error, so start simple. Find something simple without any extra straps or any extra devices on it, so you can try it out and see if it fits. You don't need anything expensive or bulky. Give it a try for a few weeks and see if that helps with your runner's knee.